What is the eCFR?
Great question, Leanne. Now, you'll hear me often refer to the eCFR. eCFR is the Electronic Code of Federal Regulations found at www.ecfr.gov. Now, at the federal level where Medicare lives, the House and the Senate make laws, they pass legislation, which go to the president's desk for approval or veto. Nothing goes from the president's signature to enforcement directly. Each element of each legislation is managed by one of the federal agencies or departments. Those agencies interpret the legislation into a set of rules to make it work. Those rules have to be drafted. They're required to be proposed and delivered to the public for comment. The comments have to be collected, analyzed, and taken into consideration. Then a final rule is published and goes into effect shortly thereafter. All rules are continually subject to adjustment as the federal departments responsible for them learn from experience. Even in the absence of changes to the legislation, rules will be adjusted from time to time to reflect the agency's experience and to better match the legislative intent. Thus, we get an annual cycle of rulemaking for many of the rules, and particularly in this context for the physician fee schedule and the quality payment program, which is lumped in with the physician fee schedule. Now, for the physician fee schedule and the quality payment program, we typically see a proposed rule early July every year. We typically have until early September to have reviewed that proposal and to submit comments. Then the comments are reviewed, and the proposed rule is then worked into a finalized rule and released typically November 1st. New rules go into effect usually January 1st, ready or not, and then the cycle starts over again. Now, if you've ever read the proposed and final rules, they can be tedious, especially the final rule. The text is repetitive, it's detailed, and it's often without sufficient context or definition. When the final rule is published, it is recorded in the Electronic Code of Federal Regulations, stripped of all of its redundancy and detail, and inserted into logical sequence with the specific rules that it updates. The eCFR tends to have a good organization, it tends to have a great table of contents, and it has indexing that the final rule lacks. Now, I still read the proposed and final rules. They keep Mingle right on top of the changes as they happen. But I've been enjoying, particularly recently, doing my in-depth reviews and answering questions using the eCFR as my go-to source. Once you crack the code, the eCFR becomes pretty easy to navigate. Is that it has a global organizational hierarchy that makes some sense. It has search tools that are decent. They lag a little trying to use real language, but when you're searching for a specific subject by its location in the hierarchy, it flies. Of interest to me, and probably to you, since you're listening to me, the hierarchy of most importance to us is Title 42, which means public health. Chapter 4 within Title 42, which is the Centers for Medicare and Medicaid Services. Subchapter B under Chapter 4, which is Medicare. Part 414 under Subchapter B, which is the payment for Part B services. And Subpart O under Part 414, which is the merit-based incentive payment system and alternative payment models, that is the Quality Payment Program, or QPP. That last Subpart O, has a decent table of contents. Now, the eCFR is the official home of Medicare rules. It's the gold standard, or the single source of truth. As Medicare updates the rules, they will collect the current rules in a variety of public-facing ways, including webinars, slide decks, frequently asked questions, getting started guides, and others. You'll find a lot of these documents and sources accessible through the Quality Payment Program, the QPP.cms.gov website. Inevitably, you'll occasionally find disagreement between the rules and the public-facing content that they spawned. In such cases, the rules are the source of truth. Most often, I see Medicare honoring both sides of that, the truth and its error, until it corrects the public-facing content to match the rules. Sometimes those epiphanies lead to an adjustment of the rules, but always in the context of annual rulemaking. They might update those public-facing guides immediately when they see an error, but the rulemaking is always adjusted in the context of that rulemaking cycle, going through proposed rule, comments, final rule, application. Thanks. I hope this helps understand what the eCFR is.